All right. Okay, good. So, Dr. Halpert, good to see you again.
Good to see you
I can't say nice to
too.
meet you because I've met
No,
you before.
we have met already.
That's
Yeah.
right, because you're down in Medellín at BioXcellerator. And so we have a little extra time, so this is great. So you didn't just wake up and be working with stem cells and a BioXcellerator. So how did you get from medical school to what you're doing now?
Okay. Yeah. So thank you for having me here. This is
Yeah.
amazing. It's amazing to be here at the COM event.
Yes.
It's my first time in the COM event,
Okay, yeah.
so I'm very happy to be here. I wanted to come last year, but I couldn't make it.
Okay.
So I'm an emergency physician. I was the director of an emergency room in a big hospital in Medellín, Colombia.
Yeah.
And then I started questioning a lot about conventional traditional medicine because I was really not finding that we were really changing people's life and that we were not addressing the cause. So that made me question, like, there must be something else. There must be something else. So I came to regenerative medicine field. I started at BioXcellerator. We start everything from zero in Medellín, Colombia. BioXcellerator is an American company that decided and choose to come to Medellín, Colombia, because being able that we can work with stem cells very easily, like navigate all the regulatory issues very easily, which is not yet, it was not yet in the States, but all of this is already starting to change, and it's a very interesting change. So yeah, that's how I started at BioXcellerator, from zero to now a big ecosystem and platform that we integrate a lot of different services.
Okay. So now we're going to kind of fast forward because it started kind of where we are now.
Yeah.
And it's
yeah,
come
yeah.
a long way. And, you know, I'm very grateful to have seen the facility and the clinic, and it's amazing, right? But you guys are doing some newer things, and it's really cool to hear about. And so there is, obviously, with stem cells, there is this strong applications in pain and orthopedics and healing, and that's great. And you guys are doing work with the Wharton MSCs, and so that's great. But it looks like now you guys are starting something newer where you're combining the exosomes, the Evo exosomes, with the MSC stem cells. And so kind of what's the genesis of that, and are you seeing outcomes with that already?
Yeah, so we started working, our first line of cells was Wharton jelly mesenchymal stem cells in normoxic conditions. And since we collect a lot of data and we are doing a very structural follow-up, we were able to see like how much our patients were improving. And because of that, we're able to continue improving our products and continue improving our protocols. So we decided to have another line of cells and culture them in hypoxic conditions, and that made them more powerful, like better functionality, better potency. And when we do all these preclinical studies, we saw that all of these bioactive molecules were higher in concentration, but also higher in number. And that made that hypoxic cells were more potent than normoxic. So when we started on our patients, treating them with hypoxic cells, we start seeing an increase in the scales and the scores and everything that we measure. So all of our results started getting better. From normoxic to hypoxic, let's say that there was an increase of improvement from 40 to 60%, so it was a big improvement. So what this is important is that you see that a product, how you culture, manufacture the cells, it makes a big difference because you can have less or higher potency. But then we got exosomes or evoke exosomes. We developed this new product. We're always developing and doing research and development and making new products. So we came up with this new product that it comes from the culture media where we're growing our cells. We get all those vesicles and we filtrate them by the size. So we have a very high concentration of exosomes, very pure, because it's extracted by the size of the vesicle. So we started applying exosomes. So some patients had cells and some patients had exosomes. And so with the exosomes patient, we started seeing that pain was going away faster. They were improving of pain. They were not having a lot of swelling or mobility limitations after the procedure. And that was weird. Like, okay, that's different. Because when we apply cells by itself, we were seeing that the results started like 6 weeks after the application of the stem cells, and that those patients were having a lot of inflammation and a lot of pain because of the procedure itself. And compared with exosomes by itself, we were seeing that they were starting to say improvement of pain very early. In the first 24 hours, our patients started saying like, okay, my pain is much better now. And we were like, no, that's impossible. It's going to take a while. But so we were, actually at the beginning, we were not believing our patients. But then we started like, okay, all of our patients are starting to say this. So we said like, there's a mechanism of action that is actually being different. Even that the exosome is coming from the cells, is a different mechanism of action. So we started, okay, let's combine them. So now we are treating our patients with the majority of orthopedic and sports medicine conditions. We're putting the combination, stem cells and evoke exosomes at the same time. So what we see is that we have patients that are saying less pain, relief of their chronic pain, and less inflammation after the procedure. And then we start seeing that at 6 weeks, the cell starts working, and this continue on until 18 and 24 months. And that's what we see when we track all of our results and information, is that they continue improving in the scores and the scales and everything that we measure. I think that, for example, what's the difference? Because I think that's super important. Like, okay, if exosomes are coming from cells, why are you applying cells and exosomes? That might be a good question. So when we have an environment and we put live cells, that is why it's super important that you're working with live cells. When we're putting the live cells in this environment, let's say the knee, let's say we're treating the knee, that cells is going to be sensing the microenvironment and it's going to be producing exactly the specific biomolecules that knee needs to change that microenvironment. So that starts working 6 weeks because they have to sense, then they have to manufacture inside like all the cargo, and then they have to secrete all that cargo in this environment that is going to be modulating all that environment. While exosomes, it already has the cargo. And that cargo was, when the cells were in culture media, they were sensing that environment, hypoxic environment that is making them release more potent biomolecules. So the biomolecules that the cells are producing and that they're being released in the exosomes in the culture media, it has already a specific cargo. So when then you compare the cargo of the stem cells in your knee with the cargo that we are adding, it's different biomolecules, it's different factors, it's different anti-inflammatory cytokines. So what we're seeing is that we're having like a immediately address of acute inflammation, and then later on, good thing about the cells with the modulation, the anti-inflammation, the stimulation of regeneration. So the combination makes actually perfect sense. So when we added for 40 to 60 with normoxic to hypoxic, and then hypoxic with exosomes, we saw an increase of 10 and 20% in the results. So we're tracking all of these results. That makes us be able to improve our protocols, to improve our products, and to be developing new technologies. So, for example, in orthopedic conditions, the improvement with hypoxic cells was being around 60, and now with the combination is between 70 and 80%, and that's amazing.
No, it really is. It seems like, and this is very much simplifying, it's almost like a relay race where it's like, the baton, where the exosomes are sprinting out of the gate. They're running really, really fast, and then they pass it. It's an interesting race. So the first part of the race is the sprint, and the second part's the marathon.
I like it how you put it that way.
All right, here's the baton, go run the marathon, and that's your stem cells because they're going to take it a longer way. But you need that sprint out of the gate because people, when they're in pain, they kind of want to get out of pain fast.
Of course.
And then, as you know, some people, and when you do the follow-ups, they're like, oh, I don't know if this is working because it takes a little time. So this can give them that greater outcome, and that's really awesome. What other clinical areas are you guys looking at to focus on or prioritizing as you look towards the future of regenerative medicine?
Yeah, so we are developing new products. We're very advanced actually already of getting peptides from the stem cells.
Good.
So it's something new, something very interesting. We're still learning about it. We're still doing a lot of research and all the conceptualization phases and all the development phases. So peptide is going to be the other product that we're going to be launching this year. We still need to understand better how it works, what are the medical indications, what type of peptides are there. Now we know that from that culture media and those cells, we got 3,500 different type of peptides. Wow. Now we have to start understanding what type of peptides are there and what are going to be them good for. We're also always like opening new services. So last year we opened ear, mouth, and throat. We opened gynecology, infertility, because we found very good evidence coming out with supporting efficacy and effectiveness and safety in specific conditions. So when we find evidence that supports our therapies, we decide to explore, learn, do all the synthesis, the evidence synthesis, and all this, getting all this information to create new protocols and open new services and new specialties. The ones that we're going to be working this year is that we decided to become a center of excellency in pain. We're working to get that certification. It's going to take us like a year to become a center of excellency focused only on pain. So we're going to be becoming experts in pain management with regenerative therapies. And also we are going to be opening vascular medicine. So we are seeing a lot of evidence that with ulcers and patients that are having very bad circulation, stem cells are very good with angiogenesis. So they're going to be stimulating new blood vessels, and it's going to be improving the ulcer be able to close, or that we can avoid and prevent ulcers, or that we can avoid and prevent actually amputations.
Right.
So those two services are the ones that we're going to be opening probably this year. So we're always working in quality. So we're always looking for the next certification, in developing new products and new technologies, and in opening new services when we find very good evidence.
Oh, that's really cool. So one of the things that I really love when I went to visit you guys is that it was an entire, I called it the it was the data room, right? It was very much, it was like, well, what's going on in there? It's like, oh, this is where we're doing like our case studies, they're collecting data, they're using this, and I thought that was really cool because you're not just injecting people and say, bye, see you in whatever time, on to the next person. You're using that data. How is BioXcellerator leveraging that patient data to advance the field of stem cell therapy and also improve your internal processes?
Yeah, that's a very good question. So the area that you were mentioning is bioscience.
Yeah.
And that area is our research and innovation center. We have 7 epidemiologists working. It's where all the science comes and where we create our protocols, where we study for new product production, where we collect all the data. We have a clinical care program that is another area where we are collecting all the data. We are following up with our patients. Is a structured, standardized follow-up. It's very robust. We have data from already 4 or 5 years. We have been collecting data. So what we do is that we get data before therapies and we get data after therapies in a very standardized way. All that data then is sent to BioXcellerator, where they organize the data and do all of these statistics things of epidemiologists. And it's very important that we have this data because it's what has allowed us to continue improving and adjusting our protocols. For example, with autoimmune conditions, rheumatoid arthritis, we were not seeing very good results. So we started like, okay, what's going on? And then we saw that actually we needed to decrease the number of cells, not increase, decrease. And so we decided to decrease the number of cells, and we start seeing results. For sure, that has to be with immune modulation, and maybe too much, not always is better. And in this case, less number of cells was better. But what allowed us to be able to do this is how we track our data, how we track all of information to continue improving our protocols, to continue improving our products, and to continue developing new products.
Very cool, very cool. So, and I did a podcast with Eric, and this is going to be a similar question, but I think this is a super important question. If someone goes online and Googles stem cell therapy, they're going to see a lot of clinics, right?
Yeah.
And there's Mexico and Costa Rica and Panama and all these different places, right? And then BioXcellerator as well. So there's a lot of different places. But if you're a healthcare provider and it's like, hey, I have a patient who I think is going to be a candidate for stem cell therapy, what's the most important thing for the providers to know to differentiate or separate, or even more directly, what's the difference with BioXcellerator versus some of these other clinics? So what is that thing that's like, hey, that approach that makes it stand out and is going to offer better outcomes for the patients?
Yeah, that's super important. What makes us different and what actually set us apart from all the people that you mentioned within all these countries. Yeah. We're not just only a clinic applying, we are really actually a big platform and big ecosystem that we are selecting our patients in the correct way to ensure who is the best candidate, who we can expect better results. So the selection of the patient is super important. Then preparing the patient, so preparing all of that, let's say it's epigenetic, lifestyle, specific biologic of that patient. So preparing the patient. So it's like optimizing all the systems, metabolism, inflammation, stress and sleep. So we do all of these optimization therapies before and during, and that patients continue with after, because you have to improve the environment where you're going to be applying the cells. And if you don't do that, it's like putting a seed in a bad soil and you have not worked on the soil so that seed can grow. It's exactly the same with stem cells. We have to improve the body, we have to improve the systems so that when we apply the stem cells, we can expect and see much better results. In the clinical side, where we have specific protocols developed for specific conditions that allowed us to have a standardization and to be able to be reproducible, the data that we are collecting. And then we have all this area of the data collection that is what really set us apart of all the others that are not getting their data, they're not collecting their information. And then we have bioscience where we do all of the research. But the most important is bioxtech. We have our own lab. So we have everything integrated. We control every step of the process. We don't purchase cells from any lab. We produce our own cells. We control the quality. We control the potency. We control the functionality, the viability. And all of that together is why we see this type of results. So all these clinics might be applying stem cells. It's not the same. All the products are different. And potency and functionality and viability is different. So we handle the manufacturing, the handling, the timing, the application, and all of this integration is why we have the results that we have that I don't think anyone is having the results that we have, and they're not even measuring their results. So that's super important.
Okay, gotcha. I know they're going to put the information on how to get a hold of you guys, but just, just for the audience listening, if someone's interested in learning more about BioXcellerator and stem cell therapy, how can they find more information?
Yeah, they can find us in our webpage, bioxcellerator.com. They can find us in Instagram. They can find us in all the social media channels. The business marketing sales part is in Phoenix, Arizona, and all the operation medical science is in Medellín, Colombia. So yeah, you can find us through our channels.
Okay, very good. Well, Dr. Halpert, very great speaking to you. This is really awesome and amazing to learn more about BioXcellerator, and hopefully people listening to this will be able to take this, contact you guys, and learn more. And I'll be seeing you soon.
Thank you, Dr. Jones. I enjoyed a lot your questions. It was a very interesting conversation. Thank you.
Thank you.